my strongest source of motivation in the role were the people I met and what I knew about the Nigerian spirit. It is their story that we curated into this book. So if there's anything we want to take out of it is to reignite the belief that even now when things seem to be really difficult in our country, that somehow we can still make it work.
It's my absolute pleasure to welcome Chikwe and Vivianne Ihekweazu. They are here to talk about their fascinating new book called An Imperfect Storm, a memoir of a pandemic and the coming of age of a Nigerian institution. So first of all, I think you're both the first public health couple to come on the podcast. So it's great to have you both with us. So first to introduce Vivianne. Vivianne is currently the managing director of Nigeria Health Watch, a health communication and advocacy organization based in Nigeria that advocates for health and access to healthcare. Vivianne has over 20 years experience in health communication and has built her skill set over a range of leading communications and research agencies across Europe and Africa in the development, media, and real estate sectors. She has an MBA from the Gordon Institute of Business Science, an MSc in Development Economics, and is currently an African Public Health Leaders Fellow at Chatham House. Vivianne's work has ranged across a number of key areas in global health, including maternal, newborn, and child health, as well as immunization and health security. She played a leading role in the COVID-19 pandemic in Nigeria, supporting the Nigeria Center for Disease Control in public health communication and developing guidelines over the pandemic. Vivianne, welcome to the podcast. It's a pleasure to host you.
Thank you so much. The pleasure to be here, Kazim.
And to Chikwe is the Assistant Director General for the Division of Health Emergency Intelligence and Surveillance Systems in the WHO Emergencies Program. He leads the WHO Hub for Pandemic and Epidemic Intelligence, which is a global collaboration that aims to address future pandemics with better access to data, better analytical capacities, and better tools for decision making. Chikwe has over 25 years experience in epidemiology and public health and served as the Director General of the Nigeria Center for Disease Control between 2016 and 2021. He's developed his skills across a number of senior public health and leadership positions, including at the South African Institute for Communicable Diseases, the UK's former Health Protection Agency, and Germany's Robert Koch Institute. He's also completed the European Programme for Intervention Epidemiology Training, as well as the UK Public Health Specialty Training Programme in 2008. Chikwe, welcome and thank you for joining us.
Great to be with you.
Now, so as I was saying before we just started, the book was a really enjoyable read, and there are so many ways I could kind of describe it. It's firstly, I think, an incredible story of the pandemic in Nigeria. It's a story, I guess, of the challenges of building a public health institution. But I think more deeply than that, I would say it's also a story of your family, your friends, your colleagues, and the support giving each other during such a brutal pandemic in Nigeria. So perhaps let's start with how this book came about. I wonder whether you could speak about how did the idea of the book come about, and why did you decide to write it?
To be honest, this book started with Vivianne. You know, every time I came home during the pandemic, during the peak of the pandemic, you know, she would ask me, "So, darling, how was your day?" And this would typically be around 10 or 11 p.m. almost every night, right? I would spend an additional hour in the sitting room, and I would go through the day with her. And, you know, as she started taking note of the stories, and the stories just kept growing, and had such a great impact and spectrum from the personal to the absurd on to the political. And so that collection of notes was really the foundation of the book, because we all at some point in our lives have an intent to write a book. Many people do. Most of the time, we never get around to it because we get busy with life. But I think it was a book we felt we had to write because of the spectrum of experiences we had. And secondly, the need to tell the story of the pandemic from somewhere other than where most of the stories emerge from.
And Vivian, was that very much? I mean, that's really useful that you had a lot of notes, I guess, from those conversations. But I guess it must have also been. Was it a hard process to write? But it's also very personal. Was there any kind of reluctance of the kind of the angle of the book and how deep you would go?
To be honest with you, what it started off with is when Chikwe says notes, he's been very generous. It was an Excel spreadsheet where I literally had the days of the week, and he'd come home and I'd just write a few, sometimes he's speaking, I'm just tapping away just stuff he said. In a way, I just felt we needed to document what was happening. And I think the genesis was also thinking back to the Ebola outbreak, where a lot of stories, but not a lot of stories that came out of how the country responded, more from a human aspect. So you'll hear the clinical numbers, this number of people died, but never the human response. And I think this one was different because everybody was going through the same thing globally. And it was frightening. There's no sugarcoating. And, when you ask about the personal aspect, I think our experience was different because we were literally at the forefront, on the front lines of the response. But behind that, there are so many stories that people experienced. And in a way, for me, it was a bit cathartic, really, to share that experience. Because I have no doubt that when many people read it, a lot will be learned and a lot will be remembered, for better or for worse. And I think it's always important to remember, lest we ever get into this situation. What have we learned? How can we do things differently? From a clinical aspect, but from the human element, from a human aspect too. Because behind all the testing, the diagnostics, all of that clinical aspect, there are human beings that are behind all of this. And I think that element kind of came out later on, through all the mental health stories that were shared. So for me, that's why it was important to share it, to document it. In terms of how personal it got, for many people, there are many elements people can relate to. So I think that for us was part of why we did this book.
Yeah, that's really interesting. Also, that it was cathartic, that it kind of helped process the pandemic. But I guess starting off with the beginning of the book, the first kind of early chapters of building Nigeria Center for Disease Control. So Chikwe, you took over at the Nigeria Center for Disease Control back in 2016, well before the pandemic started. And in the book, you described some of the challenges of developing the organization. I guess before we talk about that, I think we should probably talk about the moment in the book where you both have the realization of what was going to happen next. So where, Vivianne, you realize almost without words that something was about to change. And you kind of describe in the book that you kind of see a look in Chikwe in between calls and you realize that perhaps something was about to change. So I wonder, Vivianne, whether you could talk a little bit about that moment of where you were on your journey as a family before you took that, before Chikwe took on that NCDC role. Because I think at that point you'd been in South Africa for a number of years, right?
I'm smiling because that look has continued to feature in our lives several times afterwards. I think against the backdrop of when we met to that moment, there had been many of those looks because our life has just evolved almost, how can I put it, unpredictably often. And I've become used to that change. But that change has brought us a lot of opportunity, let me put it that way. And it's always been good. I think for me and for us as a family, we've gotten used to, because of the nature of Chikwe's work, and because of the sort of person Chikwe is as well. He's not somebody who just stays still. He's always thinking about what's the next thing to do. How can we do things better? And a lot of it has been incremental, actually. So opportunities have come, his way through sheer hard work. And you were mentioning the people who, the young public health, people in public health. I think for me, without digressing too much, the message is there's a lot that one can do when you put your mind to it. And what that has led to is opportunities have come our way. And a lot of those changes, I've always accepted them knowing that this is something that will be good for Chikwe's growth as a career, but good for us as a family. Because, we have 2 kids. And through that experience, they've been able to experience many different opportunities. We've lived in different countries because of it. And we've learned through those experiences. And me, myself, I come from a background with my dad also traveled around a lot. So I'm used to change. And to be honest with you, when that happens, I just take a deep breath and say, okay, on to the next.
We come from a country where we in Nigeria, we know that we can be so much more than we are at the moment, right? So in my generation, we've grown up always yearning for something more. So in a way, even though at that material time, and I described this in the book, I wasn't expecting a call to service. I knew just by the coincidence that I'd worked in national public health institutes all my career up to that point, that this was a role I was prepared for. So when the call came, and it wasn't like I don't want to give away too much, but because I want colleagues to read the book, but it wasn't like I was called for an interview and I was asked and I was offered a timeline with which to respond. I was literally told, your name will be announced and it will be in the papers on the next day. And, I had to confront, I couldn't say no, obviously. This was a call that I couldn't possibly say no to. But I also had to then explain to everyone around me. And explaining to Vivianne was probably the kind of trickiest part of it. And we describe in detail how that happened in the book.
That's really fascinating. But I guess, in the book you describe, taking over at NCDC is quite a challenge, and you say in the book you kind of describe NCDC as almost like a neglected orphan, where the workforce sometimes lacked motivation and it needed someone to really reinvigorate it. There were also points in the book where you're second guessing yourself, where you kind of think, have I bitten off more than I can chew, kind of thing. How would you describe those early years at NCDC? It sounded, in the book like it was a real challenge, but you were also very motivated to make it work.
I started off at HPA in its early years, right? And it was just becoming the agency that it was ultimately. And it was absolutely an incredible part of my career, seeing it grow, seeing it evolve, living in that Collindale building with all the labs and the epi infrastructure and the mentors I had early in my career, and getting to NCDC at the time. There were these extremes, like you mentioned, of both excitement of an incredible opportunity, but also the reality that there was very little to work with in the beginning. But I guess my strongest source of motivation in the role were the people I met and what I knew about the Nigerian spirit. When I came to NCDC and people were obviously, not working at their full capacity, I didn't really necessarily hold it against them, because in life, a series of things that come together that enable you then deliver on your mission. It's a combination of opportunity, your own endeavor, the context, and all these coming together, and you using it, or all of us using it the best way possible. So I think in the opportunities I've had of my career, the opportunities of travel, of exposure, of coming back to Nigeria, these are the different dots that needed to be connected. So when I met the colleagues that were at NCDC, I felt they had the dots, but they were not yet fully connected. So my mission, I felt, was to help them connect those dots, and in doing that, help the institution to grow. And that's what I went about doing. And, it's very important that when I recognize people sitting around at the very early days and not really pushing as hard as I knew they could, not to dismiss them as being unable to push, but recognizing that they had it in them. they must have had it in them for them to be in these positions. But for some reason, they were not delivering to maximum capacity. So our collective responsibility was firstly to identify the gaps, fill them as best we can, enable the context to allow them to deliver a little bit more, and then ultimately to become a highly delivering team, and to do that together. And this was challenging in the beginning, like I said, but ultimately, I think that's what we did. It wasn't magic; it didn't happen overnight. But the same colleagues that were not delivering at all in the early days, more or less, were the same team that ultimately pushed over and beyond to drive the organization forward.
It definitely came across as really strongly in the book and your chapter on leadership that when you came in, you really wanted to connect with your staff, not only to understand their skills, but also their motivation of why were they there and what do they want to achieve. Can you talk a little bit about your leadership approach when it came to motivating staff towards this mission? I guess particularly staff that had been there a long time, or staff that had transferred from other parts of government, perhaps.
Yeah, I don't know if I had a particular strategy, but I just knew what we needed to do, right? And I needed to show them and convince them not only that it was possible, but I was also committed to it in the long term. And so when you get any new leadership challenge, the first few days and weeks and months are always generally energizing, and you put in a lot of effort. And many people suspected that, listen, that I would tire out, or the challenge would tire me out. But, in a way, I think when they realized that I wasn't going to stop, I had no intention of stopping. So eventually, some of them just gave in, probably out of desperation, to get some of their lives back, and started aligning with what I tried to convince them that we could achieve collectively. I describe in some parts of the book, when changes started happening, when some of the colleagues wrote their first publication ever and got published, the impact they had on them, or when they went on a mission to a state somewhere in Nigeria to support the state in responding to the outbreak, and came with the authority that they're coming from NCDC to support, and how empowering that was. So suddenly, at some point, they started believing that, wow, look at me doing X, Y, Z. So I don't think, in a way, it was about what I came to achieve or whatever leadership strategy. I think we all have those. But I think what really happens is when people start believing in themselves and not in whoever the leader is. I think that was the sweet spot. And when I started seeing that happening, and then it's being amplified and transferred from one generation or one cohort to the next, I thought we were onto something. And so to me, I think once you get to the stage where things are happening without your oversight, then there may be something in there about whatever context we're in.
So the sort of famous phrase that you have in the book of keep pushing, eventually I guess filtered down to everyone else. And
to be honest, because in that phrase, I don't know where it came from. I can't even know where they started, but I said it a few times, and people started recognizing that I was using this a lot and started repeating it. And then it took on a life of its own, and now even my children tell me to keep pushing whenever there's something to.
I don't know, was that an option for the title of the book at one point, or?
we can consider it, but I think also adding to what Chikwe mentioned in terms of how do you get people to believe in themselves. I think the environment, I have a private sector background. I've never really worked for public sector, for the public service, which Chikwe has most of his career. And I think in Nigeria, what we find often is the public sector is full of procedures and protocols and hierarchies and all of those things. But I think what was successful, one of the things successful at NCDC was, yes, you do have that public service background, but what it enabled was an agility that was brought on by a young group of people who were motivated to work, because public sector is never agile. But I think what ended up happening, a group of young people who started to believe in themselves, felt empowered to take decisions, which is almost unheard of and continues to be unheard of in public service, especially in Nigeria. So I think that was an added difference in what was being built. So when you talk about the building of an institution, it's almost like there's a message in there, which is we have a very young population who have brilliant ideas. They just need a platform and to be an inspirational leader. Although where you say you don't want people to see you that way, but you do need something and someone to believe in, and someone who believes in you. And that definitely helped a lot from what I saw and what I kind of experienced when I was working with NCDC during the COVID-19 response.
So using that kind of enthusiasm of youth, I guess, in Nigeria. But on that point about kind of staff and colleagues, I think that really stands out in the book, of the incredible staff and colleagues that you work with. A lot of them, as you said, young, very hardworking, very enthusiastic. And there are some great almost mini stories in the book that are very inspirational. I mean, to mention some of them, Tijesu, one of the NCDC comms officers, the mini story. I won't reveal too much, but a very frantic night of creating the comms materials for that first case of COVID-19. Absolutely fascinating and inspirational story. Innocent Okoli, the intern, the mini story that you have there about him taking charge of the biomedical engineering team at NCDC and taking a chance on that youth and enthusiasm. But I wondered, Chikwe, whether you could tell the listeners a little bit more about, you have a story about a member of staff who started off as a storekeeper.
Yeah, Anwar, great guy. When I came to NCDC, he was doing his youth service year. That's a year that we spend in Nigeria after university to work in public service. In a way, he stayed on. There wasn't any guarantee of work afterwards. He started going from there. At the time, I used to kind of push all the development agencies around Nigeria for any opportunity for staff to develop themselves. So there was an opportunity for a scholarship. He got one of those scholarships. He traveled to South Korea, developed himself. He came back, has remained enthusiastic, is still at NCDC today, pushing. So, these opportunities are really transformational for people. Sadly, the reality is not that everyone has stayed on, because public sector salaries are really a challenge in Nigeria. So I don't want to paint an over rosy picture. A lot of the colleagues had opportunities, came back, worked for a few years. Many of them, sadly for the institution, but good for them, and hopefully good for the country in the long term, have left and are working in places that are paying them a little bit more. And this is a challenge we have in our country, how to keep people in public service. It's a challenge for which I don't have the answers, but we have to not give up on supporting the growth of people working in any national agency, which are all very important in any society.
Yeah, I mean, I think that comes across really strongly in the last couple of chapters of the book, which we will come to. But before that, I think the other really strong theme in the book is the importance of trust and good communication. That relationship that you talk about with the Nigerian people and explaining the pandemic through such kind of chaotic and uncertain times. But perhaps starting with Vivianne, I wonder if you could talk about that part of the book, that night where you both find out about the first case of COVID-19 in Nigeria. And you talk in the book about the importance of getting ahead of the news cycle and controlling the narrative. How have you sort of reflected on that night of that first case coming in, and all hands on deck of getting that press release and all the social media out?
You touched upon the real importance of communication. And I think what this pandemic showed is how critical it is in building trust. So that first night, I mean, prior to that, there had been so many false alarms of when the first case would be. And all along the way, almost like people were waiting for it to happen. But when it really happened, it literally was adrenaline, an adrenaline rush in the early hours of the day. And we knew at that moment, I mean, Chikwe was very calm. And it's almost like you were ready for it because you had been that person that was always called that there's been a plane that has arrived and somebody's coughing. So it's almost like you were prepared, it was prepared for that day. And quickly had to write a press release. And the reason why it was so important to get that out and make sure the story is told at that point in time, using as much information as we had then and there, is because we knew the danger of the story almost running away from us, and that leading to complete chaos in what would typically become the response. So Chikwe very, very quickly, wrote the press release. I quickly read it because, in the early hours of the day, your brain is not 100%, as you can imagine, and it had to make sense and also not frighten people more than anything. And then the next bit, obviously, I'm not to give too much away myself, is making sure that the narrative is driven by the Ministry of Health, the government, leading the response and then being at the forefront of communicating what happened. Because had that story gotten out before the press release had come out, it would have completely led to chaos and complete miscommunication and showed that the government, more than anything, was not in control. And that needed to be there from day one to support in building trust that, we're all in this together. Because looking at what we saw in Italy, I remember in Italy at that point, there were footage on TV of people on ventilators. So there was a lot of fright. People were very frightened, as you can imagine, that if this happens in Nigeria, we're doomed. How many ventilators do we have for 200 million people? We knew how our health sector was not equipped to deal to that extent. So I think at the very beginning, we had to quell as much fear as possible very quickly. And that's why at the forefront of being fast in communications, the narrative had to be shaped carefully. And thereafter, I think, the story, you can relate to what happened afterwards in the communication response from the government.
Yeah, definitely. I mean, Chikwe, from your perspective, is it, interesting, Vivianne describes it, that you almost came across as if you'd prepared for that moment all your life because the number of outbreaks that you'd already been involved in. And, in the book, it comes across as neither of you panicked. Was this sense of calm something that you always had, or is it you've developed that over your career of having this calmness during chaotic and potentially uncertain times?
You have to remember, this is what we do, because this is what we're trained to do. By then, I'd worked in this space, all my career, from dealt with situations, whether it's Ebola in South Sudan, the big one in West Africa, and incidents all over the world, really. So I knew how important it was to speak and to communicate to Nigerians in an open and transparent way on what we knew, what we didn't know, and what we were doing. And so I started off with that principle very early on in the response, knew it was important on the day and it would be important for the future. At the point, to be honest, none of us thought that this would go on as long as it did. In most other circumstances. And at that time, despite all the narratives and pictures from around the world, I was still fairly confident that we will get ahead of this, especially having been to, China as part of the early global response. Despite the hopes, the aspirations, the science, and whatever the actual circumstance is, the need to communicate calmly to Nigerians, stating the facts, was very important to me, and I thought gave our response a lot of credibility.
It kind of comes to that campaign that's mentioned in the book about facts, not fear. And I guess, to you, Vivianne, one of the things that seems to have been really tested over the pandemic was, not only trusting NCDC, but the government as a whole. And there are numerous examples in the book of, rumors and misconceptions and social media trends, directly impacting public health. I guess reflecting back and also with your experience, how do you think, that trust with the public can be improved when it comes to pandemic preparedness? Can it be maintained for pandemic preparedness, or is it a matter of being kind of agile with your approach?
Yeah, I think, the response to how you can get trust, especially when during a crisis time like a pandemic, it's a difficult one because there are a lot of things that inform people's trust. And in a way, I can borrow from look at what happened in other countries, what that trust means. And it's very complex when you want to understand what informs that trust. But, historically in Nigeria, thinking from, our independence, the types of governments we've had in place, historically, the government has not been the champion often in building trust in citizens. So there's a cynicism, let me put it that way, in the government's ability to be trusted. And this has an impact on how, for instance, in the pandemic, people now respond and engage when you come up with all this public health messaging. Why should they listen to you? You've never been there for them. So why should suddenly you're telling them to wear masks or do other? Why should they even listen to you in the first place? So the messenger was very important in this, as we saw in many other countries. But I think what helped Nigeria very much was that at a very early stage, a presidential task force was set up. And in that were government officials who ordinarily do not interface so openly with Nigerians. So every single day, we had different ministers appear on TV explaining from their angle, from their ministry's response, what that meant for them. So from aviation, from transport, from health, etc. And then you had journalists asking the questions, unfiltered, and they had to respond. So the messenger was very important in being there for once in maybe a lifetime, let me put it that way. You had a government minister who was put on the spot and had to answer the question because everybody was listening. And I think in a way, the presidential task force, which became devoid of political interference, which really helped the response, enabled the response to be led by people who were at the forefront, who knew what they were talking about. So the technocrats, yes, it was Chikwe and then Dr. Sani Aluyu who led the presidential task force. And then the ministers who were, had previously never really engaged with the public. So in building that trust, it wasn't easy and still remains challenging. But I think for that particular moment in time, these were things that enabled that trust to be built. How that was sustained is another story. But for that moment in time, that mechanism enabled trust to be built as part of the pandemic response.
That accessibility, I guess, to government, which wasn't seen before. Yeah, that's really interesting. And I guess on that point about the government and I guess politics, another thing that was really strong in the book, obviously COVID was a very brutal experience. And I guess as a public health trainee, it was quite fascinating to observe globally the interplay between politics and public health, which I guess, in my career, I've never seen such strong conflict at times and strong kind of overlap. And I found, Chikwe, in your writing that this was almost a running theme in the book, and you include some really interesting stories, which I won't spoil again, but there are a number of fascinating stories in the book about, working with the Minister of Health and other people in government. I guess without going into the stories, how have you reflected on some of those stories, and what are your sort of tips to those training in public health about how to navigate this interplay between politics and public health?
So many of us hope not to be in that position, right? And it's tricky because your views may not always align with the politics of your country at any point in time. Sometimes they do, sometimes they don't. And that's why I've been a big advocate for national public health agencies having some autonomy from government in order to be in a position to give your minister or your president, the advice that he needs, whether he wants it or not politically. But of course, it's a very fine line to thread. It can be very tricky. And like we've seen in the different COVID inquiries around the world, can have deep consequences for public health leaders. And it was interesting during the pandemic, if you look in many countries, you often had a minister addressing the public, and very often either the chief scientist or the chief public health advisor or the head of the National Public Health Agency or somebody next to him that kind of gives credibility or validates the messaging of the minister. But, whatever the case may be, I think in the Nigerian context, one anecdote I will share, and then the rest colleagues will have to read up in the book. In many countries around the world, you saw very interventionist presidents or heads of state. And very often in Nigeria, we would have loved our president to be actually more interventionist and more assertive and be there when we felt we needed him. I think during the pandemic was the one occasion where I'm really grateful that in that case, we had a bit of a hands-off president that let us get on with the work that we had to do for the country and did not try to interfere too much. We saw how that panned out in a few other countries and the impact it had on the response in those countries. So, but the intersection between, public health leadership and politics is a very interesting one. I don't think there's a right or wrong answer, but it's something we all have to learn to navigate and to pick our battles very carefully.
But was that because you had built up trust with the president prior to the pandemic, or is it because that's what his kind of natural style was?
I think to an extent he does have a natural style of letting people get on with whatever task they are. But I also think that there was some level of trust in the capabilities that we had in the leadership team, not just in me, but in the group of leaders that were assigned the task of managing the complexity of the pandemic.
That's really fascinating and definitely a good trailer for listeners to read those interesting stories in the book. So I guess from the beginning, we did talk a little bit about the personal perspective shared in the book. And Vivianne, I think that, it's really one of the unique things about this book that I really enjoyed, that it's not just about the pandemic and the public health components of it. It's really a kind of human story, of your family and the connections. And the last two chapters, really, really highlight this. And I guess linking back to what you were saying at the beginning about being comfortable with uncertainty and moving and that kind of thing, what are your reflections and perhaps your tips to those maybe currently training in public health about, or being in two minds about career moves or opportunities and that kind of thing?
From what I kind of gleaned from my experience, from our experience, is that the world is so interconnected. And in that, we often may sit in our different countries and see things from one perspective. But I think the magic and the beauty and the growth you can get from being open to opportunities and to engaging with people beyond your immediate geography, that learning experience is extremely enriching. It's something I personally have benefited from. It's something I continue to benefit from. When you go to conferences, when you're at the early stage of your career, having the opportunity to go to some of these conferences and engage with people on issues of public health in their countries. So you learn and you realize that you have many common problems or challenges. And you find other people are addressing them in different ways that you may never have thought of had you not met them. And you realize often that I think human beings were very similar in many ways. There are few foundational things that does not separate us. We often think that many things separate us, but there are many things that bring us together that we have in common that we often overestimate. Simple things like the importance of community, importance of family. You mentioned early on trust. How do you build that trust? When you are coming up with a public health intervention, who are you trying to reach? What language do you use? There's a lot of commonality in a lot of these things. And I think the enriching experience with not limiting your view to your immediate geography, I think it's enriching for anybody who's at the early stage of their career, especially in public health. Because, public health is very much about populations, isn't it? So I think that's part of why it's important.
So really kind of widening your horizons in that sense. So I guess keeping on that kind of personal aspect of the book, Chikwe, there were definitely some really tough reads, tough chapters in the book about, the personal toll of the pandemic and being in the position you were in. And not only in terms of the kind of media attention, the impact of your family, what seems to be working 24 hours a day, and some really hard stories about, a number of your close colleagues passing away, as well as your own, personal challenges. But the resilience, I think, of both of you in the book is really inspiring to read as a trainee. But I guess my question to you, Chikwe, is what kept you going through those really tough times, and how have you kind of reflected back on that period?
It's a good question, Kazim. I do, to be honest, at the time we were responding, there wasn't any time to reflect on whether to continue or not. It's like you're on a train that is moving. You're the driver of the train. Everyone is dependent on you. You couldn't stop, right? So I don't think, to be honest, I was reflecting on what the options were. We just kept going because every day the situation was more dire. And I remember one, I'll give away this small anecdote of the book, because it's something that, even up to today, I reflect on whether I did the right thing or not. We were running out of reagents for diagnostics, right? And I knew, Nigerians, I knew someone had what we needed in the country, but I couldn't get hold of the right vendor. The weekend was approaching. On Saturday, we were running low. So I went on what was then Twitter, what is now X, and said, we need X reagent desperately, right? If you have access to this, please get in touch. I was hammered by the Nigerian press and all sorts of social media actors for being not prepared for X, Y. What they don't know, that in 30 minutes, we got the reagents, we got a call from someone that had supplies, said he will deliver it to NCDC. Don't worry about paperwork. We will deal with the paperwork next week whenever you have time. So there were two things to learn from that. Firstly was, yes, you get hammered and you could lose a lot of public face. But also the positive side is someone delivered what we needed in much more quantities than we expected, and did not even request for any of the upfront payments or contracts or anything. So, but making these trade-offs in real time, when to do something radical and when to be conservative and wait for the system to work and take the safe, I can count in almost this is an extreme example, but there were examples like that every single day, right? Do I take a risk and do something I might regret? Or do I play it safe and let the system sort out? And having to make those decisions all the time is hard. And today, when I watch some of the inquiries on TV on people responding and the decisions they made, I'm not saying they're all right or wrong or everything in between, but I do think sometimes we forget the context in which we were working early in 2020 and the just unforgiving environment that we were working in those, critical months.
But I think one of the things that I took away from the book was that I think both of your roles came across as if it was more than just public health. And I think the book almost reads sort of like a love letter to Nigeria. And throughout the book, it seems like the drive of you both wasn't just public health. It was to almost contribute to Nigeria's journey as a country. And obviously, Chikwe, in the early chapters of the book, you talk about your parents returning to Nigeria when you were 3 years old, and because they wanted to help contribute to post-war rebuilding. And I guess throughout the book, it was felt that it was more than just a job. Would you agree with that sort of characterization, that there was something more that was driving you both during those challenging times, that it almost felt like a responsibility?
I think you used the right word. It's that responsibility and love of country. I think no matter, if you ever meet a Nigerian, one of the things you'll always hear is people complaining how terrible and whatever the country is, et cetera, which many people do. But underlying all of that, no matter what, we have only one country. And there was a huge sense of responsibility, and that hasn't changed up to now. I mean, I run an organization, Nigeria Health Watch, and you see the potential of a country, what it can be and what it should be. And for me and for us, I think what has really guided us, even before Chikwe's days at NCDC, has really been this love of country and this responsibility we have to the country to do whatever we can within our limit, to do whatever best we can to support it in whatever ways we can. And the people, very much so, are very much part of that. So I think underlying everything we have done and continue to do is the responsibility we have as citizens of Nigeria to support the country in whatever way, shape, or form we can.
I say writing this book just gave us just a rare insight into reflecting on the country that we can be. It gave us just this small glimpse into, I think, what we want to be, and to prove to ourselves in a way that it is possible to build. Okay, it was a short period and it was intense, but sometimes we don't lack negative stories out of Nigeria. You barely need to turn your head around a Google search to find everything you possibly can find negative out of a story. So sometimes we need to convince ourselves that these 200 million people somewhere in the middle of Africa are not all crazy, right? And that there's something that we can do for ourselves. So in a way, this was an affirmation of a belief in our country, like Vivianne said, and not just in the abstract, highfalutin way, but in the small stories of people that you see featured around this book, it is their story that we curated into this book. So if there's anything we want to take out of it, is to reignite the belief that even now, when things seem to be really difficult in our country, that somehow we can still make it work. Public sector leadership is something that is very important, that we can't get away from. In the private sector, there are many incentives for delivery. There's a profit to be made at the end of the day, the products to be built, or millionaires to be made. In the public sector, it's slightly different because, the incentives are not the same, but no country has risen ahead of the systems on which it builds a sector. So very often our challenge is not that we don't rise to the aspirations of our goals, but we fall to the limits of our system. So we have to build that system ultimately in order for our country to work for all of us.
Yeah, I mean, that comes across really strongly in the book. Vivianne, you speak really eloquently in the last couple of chapters about the journey of Nigeria, and you talk about the challenges of brain drain and historical lack of investment in healthcare in Nigeria. And you make this argument about brain draw, that talented individuals can often be drawn to other countries. And then on top of that, you talk about the underlying factors contributing to immigration of Nigerian healthcare professionals, speaking about global health and reflecting that the needs and priorities of high income countries has been kind of prioritized with little representation from health professionals from low and middle income countries. Do you think that global health as a field, when it comes to these contributing factors, needs a sort of transformation?
When I said we use the word global health, yes, health is whilst we use the term global, sometimes it doesn't often feel global. It often feels that there's this global, we even use it in our terms, global south and global north. So why not just say north and south? Or why even say north, why even say south? We use those terms because we instinctively understand that there is a division and there is a separation. And we see that in many ways and how it manifests in, for instance, responses to outbreaks, access to resources, using some of the knowledge from African countries, Asian countries to inform, the global health architecture and how we see responses to outbreaks. And we see that also when we now have health workers who are being, we look at the push-pull factors, who are being pulled to many, higher income countries, let me use that term, and how that now shapes our ability to respond to outbreaks. So when we now have this pull or this draw to more high income countries, we are losing our young, and how do we now redress that balance? And there is an inherent inequity, and it continues to manifest in so many different ways. I mean, I can give you a very simple recent example. Even people from African countries, their access to conferences, that is often limited by the passport they carry. And that is an inequity that plays out. And it plays out in my organization all the time. And to see that happening is really, really difficult and really, really painful. Because when we use the word global, we have to be sincere that it is global, that it's not just those who have the means have access to this global, that global is truly solidarity, collaboration, partnerships on an equal footing as much as possible. Yeah, so to answer your question, I think the brain drain has exacerbated and has intensified in recent years. And we really need to think about how that balance can be redressed in a way that is equitable for everybody, no matter where you are in the world.
And Chikwe, linked to that, in an early chapter in the book, you talk about, I guess, the challenge of building research capacity at NCDC with the backdrop of parachute research from high income countries, where you describe, researchers drop in for a short period, they conduct a study and they leave without that appropriate acknowledgement, and high income countries are perceived and recognized as the kind of foremost experts in infectious diseases. I guess, how do you kind of reflect back on that parachute research that may have been happening across low and middle income countries, and how do you think it could be addressed?
Yeah, so this really is a big challenge. There are no easy answers, because these are inequities that have grown over many, many years and decades, and we perpetuate them. And I challenge this in NCDC by confronting it and making sure that whoever came felt both a responsibility to build with younger colleagues there, and older colleagues, but with respect. And, I saw many people change from that, because, when you come in with a mindset to do that, you're not even open to the opportunities that building a long-term relationship can offer you, right? But when you allow yourself to be open to those opportunities, then you end up not with one publication, but with a lifetime of collaboration that lifts everyone. So I'm not going to be naive and say that we have everything we need on our country to develop the research capacity that we need to compete in the world today. But we can get there, but it takes a coming together, right? And there are responsibilities on both sides. So on our side at home, we need to build up that capacity and make sure that we understand what it takes and build up the institutions, the leadership, the mentorship, the collaboration that we need to grow. But we also ask colleagues who want to come in and do something exciting and run away and publish to be more respectful of the local context. And that's where leaders are important, because they are the ones that hold the leverage that can either decide to be transactional themselves and go after whatever is being parachuted in and out, or insist that the colleagues that he's leading are carried along and opportunities are created for mutual benefit that will lift all boats.
Certainly, that leadership of setting the tone, I think, is really, really important. It's been really, really fascinating conversation. It's a tradition on the podcast to end with a career tip. So perhaps maybe we start with Chikwe. What is your one career tip for those currently training in public health?
No, I think for me is have your plan A, but be open to B, C, D, E, and F. Because you never know. Honestly, the opportunities I've had through different stages in my career, I've always jumped at it. And when I was looking to train in London, and something happened, I ended up in the Southwest. And I was moaning about it. I ended up with a great mentor, James Stewart, I'll say his name here, who really opened so many doors for me, right? So in my initial, what I thought was a tragedy of not ending up in Colindale initially, which was my dream, to a small provincial unit in the Southwest, brought me back to Colindale in a completely different light. And from there, my career kind of took off. So just be open to the opportunities that this amazing career throws at you.
For me, the key thing is public health has so many tentacles. Find your niche and make sure that find your passion and also find your niche at the same time.
Great advice to end on. Well, it's been a fascinating conversation. Thank you so much to both of you for joining us. The book, it's called An Imperfect Storm, a memoir of a pandemic and the coming of age of a Nigerian institution, and it is out on the 8th of August. Thank you so much to both of you for joining us.
Thanks, Kazim, and thanks for sharing this story.
Great speaking to you.